combination of a normal respiratory illness plus anxiety creating, stress inducing, immunosuppression inducing fear coming out of the television 24/7. I think that's entirely adequate to explain illness, the peak of illness, and then the deaths, I'm afraid, were medical murder. The particular specialty in Italy was sedation and mechanical ventilation. Mechanical ventilation, I think I explained last time, is an aggressive procedure. When it's life-saving after, say, a head injury or for open chest surgery is a wonder. It's a miracle. It requires a skillful person and top-end equipment to not injure the patient, to keep them alive. If it's applied by people who are not used to working in intensive care and is applied long-term to people who were breathing normally with an open airway, that's a pathway to death. You sedate the person, you ventilate them, and in America they also gave them an intravenous antiviral drug called remdesivir that actually shut down their kidneys in about 25% of the cases. So in the US, in Italy, it was mechanical ventilation. In the US, it was a financially incentivized sedation ventilation remdesivir protocol. And in the UK, as shown by Stuart Wilkie, and I've seen his evidence. I had that strong sense myself from other information about the inventories, that is the ordering and the prescription of midazolam through 2019 to 2021 showed clearly stockpiling and then massive dispensing in the second quarter of 2020. So I have convinced myself that there's an adequate explanation for the illnesses and deaths that occurred, and they were definitely in any case not such as to trigger a public health emergency. And therefore, there was never a need to do all of those steps.
Dr. Mike Eden, am I hearing you correctly?
Yeah.
Am I hearing you correctly that your conclusion, as somebody whose PhD focused on morphine, as somebody who was the head of respiratory illnesses for Pfizer globally, and therefore has that respiratory expertise, having looked at Stuart Wilkie's evidence on midazolam, that your personal conclusion is that the state deliberately put people on midazolam and morphine for the purposes of terminating their lives?
Yes, there's no question. They use doses. Well, neither of those drugs would ever be appropriate in an open airway breathing patient. So if someone arrives and they're able to breathe, even if they're breathless, you would not repress their respiration, which midazolam and morphine would do. And also, per many bits of information that Stuart Wilkie was able to show us, the doses that we used were between 3 and 5 times the recommended initial starting doses. So I wrote them down and I went back to look at my clinical pharmacology books. Indeed, those are doses that you would expect would lead to a fading away of people, certainly if they were given repeatedly day after day. So I personally am convinced that the excess deaths in care homes is explained by this procedure substantially. I think we're looking at 6 figures, over 100,000 people.